Talk slow, but get ready fast. Good afternoon. My name is Michelle Shorsman, and I'm the designated media contact for the San Luis Obispo County COVID-19 Public Information Response Team. This afternoon, once again, we are here with our Emergency Services Director and County Administrative Officer Wade Horton and our County Public Health Officer, Dr. Penny Bornstein, to speak with you. Again, as with the previous days, they'll make a few comments. Wade will speak first and then turn it over to Dr. Bornstein. And before I turn it over to Wade, I'd like to again remind local media outlets and folks watching at home that all the most current information, including the case counts for positive coronavirus cases, are being updated on readyslow.org. Now I'll turn it over to Wade.
Thank you, Michelle. Good afternoon, Wade Horton, County Administrative Officer and County Emergency Services Director. I'd like to start by recognizing that this is an unprecedented and challenging time for everybody. Concern and anxiety are understandable. The county is working very hard to guide our community through these challenging times. The first issue I'd like to address today is the governor's stay-at-home order issued last night and how it relates to the shelter-at-home order that went into effect yesterday at 5 p.m. that the county issued. The county shelter-at-home order is generally consistent with the governor's order issued last evening. His order is focused on critical infrastructure. Until further guidance is provided by the state, the county's order remains in effect. We know there is some confusion in the governor's order about how it applies to private businesses. Again, until there is further guidance by the state, the county's order with regard to essential services and essential businesses remains in effect. I want to remind the public that grocery stores and pharmacies will remain open. We encourage you to purchase only what you need. We've checked in with the grocery community, and the supply chain is in generally pretty good shape. The challenge is people are buying more than they need. Let's do what we can to make sure there's enough essential supplies for everyone, and let's look out for our neighbors. We understand how difficult this time is for the public, and there are those that no longer have a paycheck. First, I want to assure everybody that there will be no evictions in the county of San Luis Obispo for those impacted by the coronavirus or the shelter-at-home order. I also want to let the public know that if you are concerned about your ability to purchase food for yourself or your family, we have resources available to keep food on the table. Please visit readyslow.org or call 805-543-2444 for information. We also understand that current events impact each of us differently. If you or a loved one are feeling anxious or stressed, please reach out for help by calling the national hotline at 800-273-8255. Again, that's 800-273-8255. For information on how to take care of your own mental well-being, please check resources at readyslow.org. I'd also like to share that we are partnering with the County Office of Education and community organizations to identify child care services for first responders, critical health care staff, and essential services workers that have no other health care options. Starting today, essential workers can visit readyslow.org to access an emergency child care request form. Our partnering agencies will use this information to align essential workers with available child care providers. And if you are an early childhood education professional or program and you are available to provide care, you can visit readyslow.org as well to access a provider availability form. Now I'll turn it over to Dr. Bornstein to provide further updates.
Thank you. Good afternoon. Once again, I'm Dr. Penny Bornstein, the County Health Officer, and I'm going to provide you, perhaps for the last time, but maybe not, the numbers of cases in our county. And the reason I say that is we are now on a daily basis going to be providing updated information through that website, readyslow.org. What we are providing is the total number of positive cases in our community and the regions of the community. So where we are as of today is 16 cases, and they divide as follows: 3 on the coast, 7 in North County, 1 now in the central area of San Luis Obispo and surrounds, and then 5 in South County. We also have available the age breakdown of the cases, and they are 7 are non-senior adults, 19 to age 64. Most of those do have underlying conditions, and the rest of them do have significant travel history. The remaining cases, 9, are the age of 65 and older. We have been able now to begin to get information on what amount of testing is happening in the private sector. The major lab that we have, the only lab that we have information for, is Westpac. That lab is available in our county, but they're not actually doing the testing in our county. They're sending it out to their national laboratory in Texas. But we know that they have done nearly the same number of tests for our community as has our public health lab. So we've been reporting to you only the public health lab testing numbers. We have now done 261 patients. Westpac has done, and there's a caveat, they've done 282, but that includes people from Santa Maria. We are still trying to get information from other other private labs like Quest and LabCorp. We do not know if they are testing people from our community, but they have not reported any positives to us, and they are required to do so. Of the positives, half of them, roughly 9 versus 7, have come from our lab versus Westpac. So that enhanced laboratory capacity in the private sector is going to ongoing be a critical element of our response to this epidemic. All of our 16 cases are still at home, isolated. A couple of them are nearing their criteria for having been considered recovered. All of them, to the best of our knowledge as of today, are doing well. And I just want to remind folks that we do expect to see these cases increase. I think those of you who have been here from the beginning, we went from 1 to 3 to 6 to 13 to now 16. That's exactly what we expect in this kind of situation. There's a lot of modeling out there that says we might anticipate a doubling of the number of cases every 3 to 5 days. So I want that when we start to hit 25 and 50 and 100, that not be alarming. It is good news if we can get more testing out there and more people identified and more people committed to staying at home with their illness and notifying their contacts, then we will have a better picture locally of what's going on in our community. So one aspect of the laboratory testing is that we continue to have a bit of a tenuous supply chain for all aspects of the testing materials. At this time, today, we are in good shape for at least the next few days. What I hear out of the federal government is all of those components of the tests should be freeing up and made available on an ongoing basis, but we are still feeling a little skittish about the availability over the long haul. I hope and I look forward to the supply chain issue going away once and for all. But right now we are in a good shape for at least the next few days, and we, of course, will be monitoring that very closely. We also have concerns in the healthcare arena about personal protective equipment. We have been managing, not in the time frame we'd like to, but we have been managing getting the materials that are requested through the Emergency Operations Center for the healthcare community. And I stress the healthcare community because we are getting lots of additional requests from other sectors that would also like to have either face masks or N95s, and we are not able to, from the public health standpoint, fulfill those requests. But we thus far have been barely able to keep up with the supply requests for personal protective equipment for the healthcare community. That includes N95 masks or respirators, gowns, goggles, gloves, and that's the full array of what's needed to take care of these patients, and also is what is being recommended for testing. I once again want to implore the community, as you heard Mr. Horton say, we are asking people not to hoard. I continue to believe that we largely, I continue to believe that we are responding to the moment with all of our resources and all of our intelligence and all of the goodwill of our community, and I am asking that people continue to do so as we go forward. I want to revisit, because I can't say this enough, in order to help the community maintain calm in the face of this, to talk about what the transmission of this illness looks like. So yesterday I talked about the secondary or context of contacts not being of concern. There's additional information I want to add to that, because there's a lot of concern that people, that many people, or most people even, are walking around with this disease and don't know it, and they're spreading it. So let me address that head on. Asymptomatic transmission, or spreading the illness when you have absolutely no symptoms, is, if at all occurring, is a minor proportion of the way that this disease can be spread. Additionally, airborne transmission has been of great concern. Can you walk into a room and nobody be there, but the person who had the infection left 10 minutes ago, an hour ago? That is believed to not be the case. There may be some limited airborne transmission in the immediacy, of someone who is infected, who coughs or sneezes, and the residual, very microscopic particles may linger in the air for a short period of time. But we are not talking about this disease passing through air vents, passing through the entire cabin of an airplane, lingering in the air for hours on end. That is not a dominant means of transmission, if it happens at all. This is a disease that is spread by either having close, prolonged contact with someone who's infected, and the greater the illness in that person, the more likely it is for the illness to spread, or that a person with the illness directly coughs or sneezes on the person directly, or either through handshaking or getting it on a piece of your clothing, and then you immediately using your hands to touch your face, your mouth, your nose, and transmitting it that way. This is why we are drumming home consistently: wash your hands, cough into your sleeve or a tissue, throw the tissue out, wash your hands again, because the dominant way in which this disease is transmitted is through direct contact, either of the person who's sick, touching you after they've touched their nose, or coughing or sneezing on you. So with that, thank you for your time and attention, and we will be open for questions.
Dr. Bornstein, you said that there were two individuals that had tested positive, that they're close to, did you say, recovery?
Yes.
What does that mean? Does that mean they can presumably go outside their home and they're fit to do without it?
Yes, so releasing a patient who has tested positive from their home isolation is dependent on them having been isolated for a minimum of 7 days and 24 hours of either no symptoms, certainly no fever, and no fever without any use of fever-reducing medicines like a Tylenol or an ibuprofen or Advil, plus dramatic improvement in their respiratory symptoms. So in this disease, like many respiratory diseases, a cough can linger for a long time. So we're not asking that people whose cough may go on for weeks on end, but they are otherwise completely well, that individual does not need to remain in their home, does not need to be absolutely isolated. They can return to the same kinds of conditions that the rest of the public is being asked to adhere to, which is social distancing, only go out for essential items, go out and get some fresh air, etc.
Would they need to be approved through the health department, or who determines
Yes,
whether or not?
yes, we will, at this time, given our capacity to still address the number of cases we have, we will be issuing clearance letters for our patients.
Yeah, Dr. Warrenstein. So Governor Newsom, yesterday predicted about 20%, more than 19,000 additional people will need hospitalization. Do you agree with some of those numbers? And if so, what does it kind of look like here locally?
Mm-hmm. So I agree with the governor and others who have been doing all manner of modeling for this disease that we absolutely need to plan for the worst scenario. So I believe that is where those numbers come from, and we are hopeful, but nonetheless preparing, hopeful that we don't reach those levels, but nonetheless preparing. We are continuing to do that in our county. You heard yesterday from our emergency services director that has been one of Wade's priorities, is getting our ability locally to stand up the capacity that would be needed in our county should we experience those kinds of numbers. Obviously, it wouldn't be 19,000 in our county, but our proportion of that. So we're looking at having hospital surge capacity. We've ordered ventilators. We have ordered ready meals. We are doing everything that we can to be ready for the possibility of a healthcare surge that exceeds our existing capacity.
And another question, really quick. So you also referenced using hotels, state university campuses, to house additional patients. Has the county identified any sites locally to carry that out?
That is a work in process, and as we speak, there is a hospital surge task force that is identifying locations. They are working on memoranda of understanding, and I think that we will have the ability to invoke the use of such facilities when and if we need them.
I forget a top ask for federal and state officials to provide. Would it be protected gear? Would it be, what would that be?
Helping us locally to make laboratory testing available easily, far and wide, for all people who have any manner of symptoms. Still, the outpatient community is somewhat struggling with that, and part of the reason is absolutely connected to they need to have personal protective equipment and enough of it to feel safe to have the volume of patients who may be experiencing symptoms come into the private offices, get tested, and not be concerned that if they don't have the adequate PPE, that they may have to shut down that resource, or they may have to take a healthcare provider out of commission because they didn't have adequate protection.
I know yesterday you mentioned you were going to do a call with the providers. How did that, can you tell us a little bit about it?
Yes, I was actually my deputy health officer who wound up taking that call instead of me. I hear that it went very well. The providers are absolutely beginning to step up. I want to give them kudos. I know what seems like a lifetime ago, probably 2-3 days ago, I stood right here and I looked at you all and through the lens and asked our healthcare providers to make available services to their patients. That is absolutely moving in the right direction. Providers are getting more knowledgeable. We now have an audio training tool available to them. We hope to be pushing that out in the next 24 hours or so. the providers they know now where to call to get assistance with getting PPE and with understanding what type of private laboratory vendors are out there. And so I think we're moving in a very good direction.
What was like the main concern expressed by the providers?
Yeah, I think what you heard me say is they are concerned about infecting their staff and then not being available to provide care. They're concerned about having the knowledge and the material that's needed to address this issue. They were reassured by our ability to say, in terms of the level of illness and being able to provide surge capacity for hospitalized patients, that I think that's a very reassuring thing for them.
Can you go over the breakdown again of the number of patients really quick, and then the number of tests that you guys performed, and then I think you only mentioned Westpac, right?
Right. So we have 16 positives in our county. We have tested in the public health laboratory 261 patients. Westpac has tested 282 patients, inclusive of northern Santa Barbara County.
And then you said, can you do the regional breakdown then as well for North County, South County?
Yeah, 3 in the coast, 1 in central, 7 in North County, and 5 in South County.
Question for Mr. Wade about the shelter at home. Maybe too early to assess. We're not even 24 hours in. Through the lens of what you've seen today, maybe you've heard from colleagues. How's it working? And maybe concerns as we now go into a weekend on if people will be adhering to that.
So at this point, I haven't heard significant concerns. I think the community is stepping up. They're doing the right thing, and they're taking the measures to protect us so we can get back to normal as soon as we can.
Question for Dr. Bornstein. As of right now, how many hospital beds are available in the county?
I don't have the exact number off the top of my head. I think we were looking at about 120 are open at this time. A week ago, that was not the case. I believe that we are finally beginning to come out of the flu season that had our hospital beds filled up to capacity until within the last week or so. So that's good news.
We've entered an online ordering. A lot of UPS drivers are reporting concerns as we order more things online and have shipped to our homes. Is there any other precautions that residents who take these orders should take when they're receiving these orders that are coming from larger metropolitan areas or out of state?
So surface transmission, so from the surface of a package, is a much less common way for transmission. That said, especially for vulnerable populations, again, people over the age of 65, people with medical conditions, especially if they want to go the extra measure and wipe down. And it doesn't have to be a Lysol wipe. Even friction is good at getting rid of organism. Better if you have Lysol wipes, but I don't want to be telling everyone to go out and again, run the market on those things. What's most important is your frequently touched surfaces, so doorknobs, light switches, computer keys. The possibility of a package that was sent in a 1 to 2 day time frame actually having organisms on it and you touching that organism in the process of opening that package and then infecting yourself is quite low. Thanks.
Okay, so I have one question that was emailed in. I don't know which of you wants to address this, but it came from the New Times. Has the county or will the county receive funds from the state for protecting the homeless population? And secondly, has the state or county found any hotels or motels to lease for shelter?
Thanks for that question. So, yes, we will receive funding for protecting the homeless. The first allocation, it looks like the county is going to receive about $500,000. We are working with Assemblymember Cunningham very closely. In fact, I'm probably talking to Jordan 3 times a day now. He's leaning into this effort to try to bring funding to this county to help. And I'm pleased to report that it looks like the county was able to we were able to execute a contract today for 4 trailers, and we'll be delivering 2 trailers to Echo in North County and 2 additional trailers to 40 Prado. And the reason being is if individuals are coming for shelter and presenting symptoms, they can be placed in these trailers until they can be assessed what needs to happen in the future. And what we're trying to do is maintain that social distancing and not potentially infect others in those shelters. So we're working very closely with the nonprofits. We're working very closely with our state representative. I'm on a daily call with Congressman Carvajal's office, and the congressman is on that line as well. Government is working together to tackle this situation, and I'm very pleased with the level of collaboration that we've seen thus far. Thank you.
Thank you again for coming today. I'll just close with my usual reminders. ReadySlow.org is really the best place to get up-to-date information. We're updating that very regularly. It includes already currently the level of detail on the case counts that Dr. Bornstein talked about. All of that is live right now, so you can see the level of detail that she reiterated in her comments. We also still have our public health information line that's available. It's a recorded line 24/7, and that number is 805-788-2903. And then we have our phone assistance center that is open 7 days a week, where you can ask your questions of a live person, and that number is 805-543-2444, and they're open from about 8 to 5. So thank you again for coming, and we'll see you tomorrow.
All right, San Luis Obispo County Public Health wrapping up their press conference, their daily press conference on this Friday. We have learned that there are 16 confirmed cases total right now in San Luis Obispo County, 3 on the coast, 7 on the North County area, 5 in the South County, 1 in the central area of San Luis Obispo County. 261 patients have been tested by county public labs, 282 tested by private labs. That also, though, includes a number in Santa Maria. We've also learned earlier today there's some confusion over the state and county shelter at home. The gentleman said that we need further guidance from state officials, but in the meantime, that county order that's been in place now for days remains in order, and they will try to get some more guidance from the state. Also wanted to reiterate to folks, no evictions for anybody linked to the coronavirus, having concerns about that. Also concerns about paychecks. They've got some resources for you to go to. I'll share that website with you in just a moment. Also put out a request for daycare providers. This is specifically for first responders, critical healthcare staff with children needing help. You can go to this ReadySlow.org. There are forms there that you can fill out. And on the other hand, for folks who do have daycares to provide for these folks who are needing them, again, you can go back to that website to get forms to fill out so they can connect people who are in need and people who are able. Also talked about transmission, saying that most of the people walking around don't know that they have COVID-19. Asymptomatic, no symptoms. That's a minor way to spread this. It really is mostly spread by close, prolonged contact. Again, I want to leave you with that number, 805-543-2444. We'll see you back here at 5.